My name is Fatih Dikici, and I am a specialist in orthopedics and traumatology. I work as a professor at Acibadem University. We provide treatment services to all kinds of patients. The hospital where I work is Acibadem University Hospital. It's a very comprehensive hospital. As the name suggests, being a university hospital, it has every department. I know English. Also, I am fluent in French. Indeed, I am a professor of orthopedics and traumatology focused on spine surgery. Orthopedics is the branch that addresses deformities in the human body, such as congenital, from birth, or acquired later. Fatih Dikici is a spine surgeon. I have been particularly focused on spine surgery specifically for about 25 years, since the year 2000. Besides that, I am involved in various aspects of arthroplasty, which means hip and knee prosthesis surgery, and all types of traumatology. Adults and the elderly can often have problems with aging spines. Degenerative spine diseases occur. I am also involved in this type of treatment. These can include spinal stenosis, herniated disc surgery, lumbar or cervical herniated discs, or a spinal deformity known as degenerative de novo scoliosis that develops later. We take care of them. Additionally, I received extensive and comprehensive training on spinal tumors throughout my entire education. For this, I completed my training in Japan with Professor Tomita, who is #1 in this field. I went to Professor Tomita. I worked on spinal tumors at Kanazawa University, so I also deal with spinal tumors. So whether it's primary or metastatic, I also treat cancer that has spread to the spine, infiltrated it, and caused metastasis. This is also a multidisciplinary approach. So you cannot treat a tumor on your own. There must definitely be an oncology department here. In addition to orthopedics, if necessary, there should indeed be neurosurgery, and you should evaluate the patient together with other multidisciplinary teams to make the best decision for your patient. Only then can you ultimately reach the outcome. You will achieve the best result for your patient.